this is a talk about a very specific mutation of this disease, of no disclosures. And if you ever go into the website for DADA2 Foundation, this is the girl we'll talk about today. And she's every reason why I'm standing here before you and why I'm actually studying this disease. So she presented to us Boston Children's when she was 2. She had a year-long history of intermittent fever, skin rash that looks like this. Chronic anemia and elevated inflammatory markers. She was not gaining weight. Her weight has dropped from the 50th percentile down to less than 10th percentile over a year. This looked a little bit like a periodic fever syndrome to us at once. At the beginning, as we said, intermittent fever, and so she had a presumed diagnosis of CAPS, which after several months sequencing came back and she did not have these mutations. She had minimal response to IL-1 antagonists, both anakinra and canakinumab. And we did a cytokine panel that showed that she had elevated IL-6, so she was not improving an IL-1 inhibitor, so we started her in tocilizumab, which is an anti-IL-6 receptor, and she had a dramatic improvement. Right? She was much more active. She is running around. Her labs all normalized, not just a CRP, and her anemia fully resolved. Right? End of the story. Right? Well, here's also a picture of libido that comes every now and then, which is not a prominent feature of initial presentation. So about 2 months into tocilizumab, I think we've heard that earlier today too, this is probably not a medicine that's completely protective of stroke for this disease, that she presented a couple of days after the 4th dose of tocilizumab with persistent vomiting and lethargy in ER. Credit to the ER physicians, got her CT scan right away, and it showed a large bleed in the right frontal cortex. She was taken to surgery immediately, evacuated the clot with craniectomy, and was stable in the ICU until about 9 days later. She developed seizures that would not respond to treatment. And CT at the time showed a second bleed, now on the opposite side, bleeding into the ventricles. At that point, we sent off targeted sequencing and also plasma activity assay to both Ivona and Mike here, and we started etanercept shortly afterwards. So this is her activity level, where you can see the patient is totally deficient in a couple of assays here. Mom sample is in his carrier range, which suggests this is truly a DADA2 phenotype. And the sequencing showed 2 mutations. One is a threonine 129 proline substitution, and the other one is a large deletion that's also found in the mother. Interestingly, when we sequenced the cDNA, only the T129 substitution was found in the cDNA. So that shows you that the big deletion got rid of the last 3 exons and probably made the RNA unstable, and therefore it is not expressed. So taking this to the lab to try to define what exactly the mutation does, this is the mutation not found in the exact database, so it's not recognized previously. By prediction algorithm, it's pathogenic. And so what we can see here is that we clone both the patient and also healthy control into the expression vector, and again put it in 23 cells and look at its expression by Western, by ELISA, and also by activity assay. So shown here is the secretion data by ELISA. So you can see if increasing concentration of plasmid, the healthy control DADA2 gets more and more in terms of expression in the medium, versus using the patient's plasmid with the substitution, no matter how much plasmid you put in, there's 0 expression, right, in terms of activity. So does it get expressed at all? Right? Looking inside the cell, this is lysate. When you look over Western blot, looking at MIGTAC DADA2, you can see indeed it's expressed. Right? So wild type, you increase plasmid concentration, you get more protein. The patient actually has more protein inside the cell. Right? It just doesn't make it to the outside. Looking at this in terms of the homology, right? So what is suggested to us early on, if you actually go back to the last slide here, one thing to point out here is you can see a little bit of a size change, right? So this protein is slightly smaller than the wild type. And substituting 1 amino acid is not expected to give you a 2 kilobase or sort of kilodalton type of size difference. So this suggests to us that this shift in molecular weight is probably some type of effect on the post-translational mechanism. Comparing this through numerous species for homology, you can see it's highly conserved. The T here at 129 is down to the zebrafish. And after the last conference, actually, I noticed that one of the speakers talked about glycosylation. This actually forms a glycosylation sequence. Right? An N-linked or asparagine-linked glycosylation sequence requires an asparagine at the base 1. The second base could be a wild type or wild card for anything except for a proline. And the third base has to be serine or threonine. So this 127 to 129 forms a sequence of N, X, or ST, right? So this mutation in the T changes the T to a P, which disrupts the sequence. So is this the mechanism for this? So what we show down here is that if you look at the medium of the control is highly expressed in terms of ADA2 protein. In the T129 mutant, it's not expressed. It's inside a cell, and it's smaller, as shown before. If you revert that mutation, just change the base back by site-directed mutagenesis, you can restore the normal secretion and also normal size expression inside the cell. Now, if you disrupt the asparagine 127, which is the other part of this consensus sequence, you get the exact same thing as T189 mutation, where it's not secreted and it's smaller. So this is a very similar feature to two different mutations to show that this is probably affecting a consensus glycosylation site. We can also show this by a chemical assay. Tunicamycin is a inhibitor of N-glycosylation. And if you express the wild type and add tunicamycin, you can see that the control expression drops by about 80 to 90%. And then the little expression you get from the two mutants gets to essentially none. Right? Looking at the Western, you can see by the control, the size drops significantly by about 8 kilodaltons, versus the T129 mutant, which is smaller by a couple of kilodaltons, gets even smaller. So this actually suggests that there are additional glycosylation sites in this protein, that by inhibiting tunicamycin, you can basically reduce glycosylation on all of these sites. So N-glycosylation turns out to be a big field of science, right? So it is the attachment of oligosaccharides to a particular nitrogen atom, which is usually found in asparagine. That's why it's called N-linked. And has numerous roles for protein folding, trafficking, stability, as well as protein function. So this is from a textbook. So to see why is this mutant protein staying inside a cell, right? Really confocal microscopy. And so you can see here, this is a control where if you express DADA2, you can use the antibody to make and show the nice expression inside a cell, and has a perinuclear fashion to this. So this is a Golgi pattern, where it's a secreted protein, it makes it to the Golgi, and then makes it outside the cell. On green is ERP72, which is a ER protein, and it sort of, there's some faint localization you can see with the ER for the control protein, but not so apparent. In the T129P mutant, it's just complete overlapping with the ER protein, and you do not see this Golgi pattern here. Same thing for N127Q, which also disrupts the N-glycosylation sequence. And you can prove that this is a Golgi using a Golgi marker called giantin. This little foci, perinuclear foci, is actually where the Golgi is staining, and you don't see that foci in the mutant protein. By quantifying the co-localization of Golgi, a Golgi marker, and also the ADA2 protein, you can see for both mutant, it is significantly reduced. So it turns out there are 4 predicted glycosylation sites for this protein that meets the consensus sequence criteria. So 127 is the one we discussed, and there are 4 other ones, 174, 185, and 378. So are they all important, right? So we're looking at the sequence here, aligning with the different species. Everything is conserved for 174 and also 378, right? There are some variations in the middle one, 185, where in a couple species, the boar and the cat, it's lost the N, right? So maybe it's not as important there. So to see whether that's true or not, we made all of these clones by making some site-directed mutagenesis, and all of them had a reduction of molecular weight, right? So that suggests that in this, at least in the cell line, all of these are natural sites of N-glycosylation, equally compared to the T129 and 127 we just discussed. But if you look at outside, see what's secreted, the 127, 174, and 378 is abrogated, versus the N185, remind you that's the one where it's sort of not conserved in some species, had no effect on the protein secretion. The confocal supports the same story, where you see a nice Golgi pattern on the left here for the wild-type protein. You see it also for N185 mutant, but you don't see this Golgi pattern for the 174 and 378. And quantifying this also, that the N185, even though it is glycosylated, it has no bearing on protein secretion or function. Whereas as 174 and 378 asparagine, just like our patient's mutation, affect the, it's absolutely required for the protein folding and secretion. So it doesn't come out of the cell, but does it affect its activity, right? Is this a mutant that just stays inside the ER, or does it also affect the activity of this protein? And just measuring activity out, so secretion certainly is reduced on the top left on the A part here. But if you look at part B, which is the activity assay, these mutants, they're not totally absent. My pointer's having some trouble here. The 174 and 185 and 127, you can see some activity that's above the baseline in terms of the mock control. Right? And if you normalize the amount of protein that's secreted to the activity is actually not that bad. Most of these activities are within 20–30% of the control protein. So glycosylation, in my mind, does not affect the activity or function of the protein per se, but it does totally control their ability to migrate from the ER to the Golgi as part of the trafficking mechanism. Now, what about other mutations, right? Going through the genome aggregate database, which has probably 200,000 allele sequenced from various genome projects, and knowing what we know about these glycosylation sites, we want to know whether there are mutations in the general population, right, that affects glycosylation of ADA2. And we found 5 loss of function mutations that affect the consensus sequence, shown in the top 5 here. These are fairly rare. They found 1 or 2 alleles out of hundreds of thousands of people by these sequencing. All of these are predicted to be damaging. And then there are 2 mutations that are predicted to be gain of function, meaning that the change in the base actually gives you a new glycosylation site. Right? So it's a concept made in some of the other diseases in Casanova's group, where you have a gain of glycosylation mutation. So one is predicted to be damaging, one was predicted to be benign. And we worked this up also. These are 2 mutations. One is affecting 480, one is affecting 481 amino acid. And you can see in the middle B plot here that one of the mutations, the 480, gives you an increase in the molecular weight of the protein, consistent with its additional glycosylation site. And then the other one's the 481, where it gives you sort of see this, there's a little smear, right? It gives you a partial increase in glycosylation, so it's sort of not all or none. And similarly, looking at its secretion, the gain of glycosylation, that's a complete glycosylated site, gives you no activity, versus no secretion, versus this one that's partially glycosylated in addition to original sites, gives you sort of a partial secretion phenotype. So in summary, we found that the mutation in our patient, that threonine 129 protein mutation, is a pathogenic mutation, and it disrupts the translocation of the folded ADA2 from the ER to the Golgi. We need 3 different sites that are highly conserved to be glycosylated in order for the ADA2 to properly traffic to the extracellular space. Both loss and gain of function glycosylation mutations are probably bad in the context of ADA2 secretion. And then really precise glycosylation is required for shuttling this protein. And this brings into the point of the importance is implication in terms of gene therapy, right? If you try to replace this and try to produce this in using a recombinant technology, that we have to use the technology to where glycosylation is fully sufficient. So using bacteria is probably not the best way to do it, versus eukaryotic cell perhaps is the way to go. So with that, I think that's all.